Warning from Upstate health leaders: if action isn't taken now to combat the spread of that new variant, they're bracing for what they're anticipating could be a busy time in the COVID wards. 7 News' Melanie Palmer explains.
Here at EMBER Modern Medicine, they were seeing a decrease in COVID patients following what they call an end-of-summer surge, but that is starting to shift. The same goes at a handful of upstate healthcare providers in the area, along with the state's health department. Medical professionals at all those places tell us they are very concerned for the weeks ahead.
Let's just take this out to the...
Dr. Brian Blank has been keeping himself busy. It's flu season.
Flu is out there in the upstate now.
That's on top of dealing with COVID-19 cases.
Over the last week or so, it's looking like there's been an uptick in cases kind of across the state, a slight one.
Just when Dr. Blank says they thought COVID cases were slowing down, state data is starting to show otherwise. And he, like a handful of medical professionals, tell us they're apprehensive about what could happen next.
If we have to deal with both a new COVID surge plus the normal flu on top of that, I mean, it could just be devastating.
That it's going to be like last January, that kind of surge.
Yeah, that's been weighing on my mind.
At Bon Secours St. Francis, leaders there tell us they are prepared if more COVID-19 patients start piling in, but they're hoping it's not a repeat of January 2021.
It was pretty substantial last January what we were dealing with, and I'm wondering if between Thanksgiving, Christmas, talks of a new variant, if January will bring about another surge.
A new variant that has been detected thousands of miles away, but PRISMA health doctors predict could be here in no time.
It's probably already here. If it's not, then probably in a matter of days.
For now, though, at EMBER Modern Medicine, where vaccine rates have dropped.
There was probably that first week, a lot of parents wanting to get their kids seen, and then after that, really sort of crickets. Oh, sorry.
Dr. Blank says they have plenty of vials on hand. And doctors say now is not the time to this new variant. DHEC has still not identified or confirmed any of these cases here in South Carolina yet. However, they are just urging to be extra cautious ahead of any family gatherings for this holiday season. And of course, if you haven't already, get vaccinated. In Greenville, Melanie Palmer.